Hi, my name is Christy and I'm a speech language pathologist, and today I'll be talking about oral motor exercises. So first we'll start with the structures that are most visible, the lips. If you're noticing you're having maybe a little bit more drooling or liquid and food falling out the front of your mouth, we want to work on strengthening and coordination for these muscles. So first we'll be pushing our lips out, and we want to exaggerate every movement. And then we'll do the opposite, bringing the corners of our lips back into a smile, but really exaggerate it. And we can alternate between those. O, E. The next, if you say the letter M, you'll notice your lips really press against each other, and we want to really exaggerate that. And then the next, we will close our lips, puff up our cheeks with air. And you can either move the air side to side, or if you want to make it a little bit more difficult, we want to push against our cheek to really create that resistance and make those muscles of our lips and our cheek hold that air in. Next, we will do exercises for the muscles of the tongue, and remember, it's all about strength, coordination, and range of motion, and we want that to transfer over to when we're eating and drinking our liquids. Okay, so first we're going to stick our tongue out as far as you can and really hold it there as stable and steady. Okay, for each of these, if we want to add resistance, you can use a tongue depressor or a spoon and really make your tongue push against it. The next, we will elevate our tongue. An alternative would be to raise it up to the roof of your mouth and really push against the roof of your mouth. Next will be to the sides, and this is useful for if you're noticing you're having some food kind of getting stuck in just those natural pockets of the mouth, using a tongue depressor to add resistance on the side, or your hand on your cheek. Next, we will be moving the tip of our tongue backwards. Okay, that helps move that food and liquid backwards during a swallow. So raise the tip of your tongue to right behind the tip of your teeth, and then slide it back, but really press against the roof of your mouth, tongue. So if you notice you're having trouble with getting food stuck in your throat, coughing, or choking during your meals, we want to work on these next few exercises for the muscles of the throat, but also some of the tongue is incorporated here. So the first one is an effortful swallow, which is swallowing stronger than you normally would. So press your tongue up against the roof of your mouth as you're swallowing. Let's say this is the roof of my mouth, this is my tongue. The normal motion of the tongue when we swallow is to press up against the roof of our mouth from front to back, okay? You just want to really focus on that and press your tongue even more, okay? And then tighten these muscles of the throat. The next one is the same kind of thing. The only thing is that we're holding our voice box up at the top of the swallow, as we say. But really, if you feel your voice box, it rises up and then it drops down. That's a normal swallow. We want to, for this next one, hold that voice box up for a few seconds longer. And then we breathe out. Another exercise for your swallowing, you can lay down on your back and elevate only your head. So almost try to get your chin to come up towards your chest and then hold it there. Try to hold it for a minute and then 1 minute rest. And you can do a set of as many as you can tolerate, 15, 30. Another exercise for your swallowing is to take a deep breath in and hold it, then take a sip from your cup, swallow that, and then cough before you breathe again. And that cough is kicking up anything that might be sitting near your vocal cords or the entrance of your airway. Okay, so I'll show you. And now I'm back to breathing again.